Good morning, all. Welcome to the first in a series of West Live webinars. My name's Enam Hussain, and I'm the head of claims for the Eastern Group. Today, we'll be taking a look at how the COVID-19 pandemic has impacted on global trade and safety at work for seafarers 8 months on. Next slide, please. We'll focus on 3 areas today. Starting off, we will discuss the impact on maritime industry and the global response. This will be presented to you by Monica Whiting, who's a senior claims manager and specialist in personal injury crew matters for passenger ships at the club. She's also a representative on the IG Personal Injury Subcommittee. This will be then followed by a presentation on crew medical disembarkation, treatment and repatriation by Helen Chittenden, a claims manager and a specialist in personal injury and crew matters at the club. Helen will be joined by Nigel Griffiths of Marine Medical, who are global experts that provide marine advisory medical services. This involves complex medical repatriations. Nigel's based in Singapore, and he will talk about mental health in relation to crew. And then finally, we will discuss claims handling and where the role has been changing. This will be presented by Stephen Knaggs, claims manager and the correspondent manager for the club's global correspondent network. He will discuss overall claims trends over the last 8 months. Steve will be joined by Dughall Aitken from SPICA Services, who are one of our listed correspondents in various Asian ports. We will have time for questions at the end of the presentations. However, if we do overrun, you are very welcome to email your questions and we will respond to them in due course. So I'll now hand you over to Monica. Thank you.
Good morning, everybody. Thank you for joining. As Enam said, I'll be talking to you today about the overall pandemic and its impact on shipping. Next slide, please. In March of this year, the World Health Organization declared COVID-19 a pandemic, and it seemed like the lives of everybody around the world changed overnight. We had to put up with travel restrictions, lockdowns, social distancing, and wearing of masks. One of the major industries disrupted by this was shipping. Over 80% of the world's trade is carried by sea, which includes essential supplies such as foods and medicines, but little concessions were given to the industry regardless. The other industry that was affected was the cruise industry. When in the early days, when little was known about COVID infection, there were many outbreaks on board cruise ships, and they were quarantined with many passengers and crew stuck on board. I think we all remember the highly publicised case on the Diamond Princess. As a result, the CDC, the Centre for Disease Control, put a cease cruising order on all cruise ships, which resulted in a lot of cruise ships being laid up at various ports around the world and thousands of crew being stuck on board. Next slide, please. So the impact on crew was quite tremendous, with crew changes being denied around the world and travel restrictions and lockdowns due to the fact that crew were not designated key workers, so it made it very much harder for them to move around. Initially, it was thought it was safer for crew to be on board because there was less risk of contracting the virus. We had to think of extending crew contracts and medical certificates so as not to breach the industry guidelines on this. We were faced with problems with critically sick and injured crew that couldn't be landed for treatment due to lockdowns. As you can imagine, many of the countries were more concerned about their own citizens than helping foreign crew members. Longer stays on board obviously led to stress and mental issues, which would become quite problematic. Next slide, please. So the maritime industry's initial response to the pandemic was to follow the World Health Organization and Centre for Disease Control, which was responsible for advice and guidelines to the world. So the International Maritime Organization and the International Chamber of Shipping were responsible for disseminating this advice and guidelines to ship operators. They put together protocols for seafarer health and safety, management of outbreaks on board. However, the continuing problems with pandemic and crew changes led to the World Health Organization and the IMO putting out a joint statement for governments to relax restrictions and allow free pratique to ships and crew changes. All the industry bodies, including the international group of which we are members, got together to try and put pressure on governments to ease restrictions and allow crew changes. Next slide, please. So 8 months on in the pandemic, we all thought that it would just be 2 or 3 months disruption, but 8 months on, we're still facing the same or similar problems as we were in the beginning. The situation with crew members has now become a humanitarian crisis, and the seafarers are unsung heroes. They're still facing travel restrictions. They're still denied key worker status despite their essential role in the pandemic. We all know that our medical profession, our doctors and nurses, are given key worker status, quite rightly so, as they're doing an excellent job in keeping people alive. But what is often forgotten is that a lot of the medicines and essential supplies for hospitals are carried by ships, and it seems only right that our seafarers should be given the same recognition as key workers. It's now estimated that around 400,000 crew are still stuck on board, many of whom have been on board well over the 11 months, which is the maximum period that they should be on board. This, of course, is going to give rise to mental health issues, risk to safe ship operations due to crew fatigue. Since the beginning of the lockdown, crew changes have improved slightly, but it's still a problem, particularly with the second wave, which we're into now. Disembarkation of critically sick and injured crew has also improved somewhat, but there are still issues around assessment. We're finding it difficult to get doctors on board to assess crew to find out if they are critically ill. So this remains to be an issue. Next slide, please. The disruption to the maritime business has also been huge. There are many losses due to ship delays, quarantines. We have unreliable COVID testing, issues with even the PCR test, which is a recognised test, is only around 70% accurate, which leaves a 30% error of margin. This is compounded by the fact that you can have a positive COVID infection and be asymptomatic. So very often we don't know whether a seafarer has tested positive with no symptoms and whether this is part of the unreliability of the test. But regardless, a positive test means that ships will be quarantined even if we feel that they're wrongly, the tests have been unreliable. There's also the potential for increasing claims due to crew fatigue and stress. Studies have shown that around 75% to 96% of shipping incidents are due to human error. So it remains to be seen what the impact of this will be in the future. There's also the cost and time of implementation of COVID-19 rules on board, added workload to an already fatigued crew. For the cruise industry, social distancing is a real problem. The only way you can do it is to take on less passengers, but obviously the same operating costs apply. So even now when the CDC has relaxed the no cruise order, many operators, even the large operators, have decided to hold off cruising until the situation improves. Next slide, please. So the industry's continued response to find solutions. The main theme has actually been the plight of seafarers, which is what's causing the major problems. The UN put out a statement in June announcing that the situation with crew is now a humanitarian crisis and called on all governments to designate seafarers as key workers and allow crew changes. Again in June we had the Day of the Seafarer where the theme was #seafarers are key workers. And again the IMO Secretary General's message was for governments to recognise seafarers as key workers. In September we had the World Maritime Day and the UN Secretary General again stated the importance and vital and that shipping is vital because of so much trade going on and needed to fight the pandemic, with food and essential items being critical for dealing with the pandemic. And the situation with seafarers was again a humanitarian crisis and something had to be done. The IG itself got together with all the industry bodies to see what they could do to try and sort of ease the problem with the situation of crew changes. They worked together to come up with protocols for safe crew changes to give governments the confidence that this could happen safely. And in October, the IMO put out a circular endorsing these protocols, and some governments have taken this on board, which is a good development, and we hope others will follow suit. Next slide, please. So we at the club are also doing our bit, and our response has been, firstly, we joined forces with the other international group, forming a COVID working group so that we can share information and find solutions together. We have our own working group for COVID at the club, which provides advice and information to all our offices around the world. We have a designated website page for COVID, which provides information and updates. We have FAQs, which tries to answer many of the questions of our members. We have an online portal, which gives updated port information and other essential information about ports. And generally, we continue to work with the industry bodies and the IG to push for key workers to be recognised as seafarers to be recognised as key workers, and to assist in the landing of sick and injured crew for treatment. We also sponsor seafarer charities such as the Sailors Society, supporting wellbeing of seafarers, as we recognise this is going to be a continuing problem. We use our social media networks such as Twitter and LinkedIn to again draw attention to governments, authorities and anybody else who would want to listen that change is needed. However, it's not all doom and gloom. We've all heard in the news recently that we have not one but 3 vaccines on the horizon, which are hoped to be rolled out next year, which is very encouraging news, especially as they are supposed to be very effective. So I hope that in the next 8 months, we won't still be talking about this dreadful pandemic, and that things will get better for all of us. Next slide, please. Thank you all for listening. I hope this has been informative. And now pass you on to my colleague, Helen Chittenden. Thank you.
Thank you, Monica. And good morning, everyone. My name is Helen Chittenden, and I'm a claims manager at the West. And I wanted to talk to you today about our experiences in assisting members with crew illnesses and injuries during the pandemic. So we all know that some of the instances, some of the things that we used to do before the pandemic that were straightforward have now become more complicated, take longer and are more costly. And unfortunately, that is also the experience that we have had in assisting members with crew and injury and illness matters. Next slide, please. So dealing firstly with crew illness, we always need the assistance of local correspondents when a crew member is about to be disembarked at a port in another country, but this now is more essential because we need to know from the local correspondent what difficulties we may encounter when the crew member has to be disembarked, if indeed the crew member can be disembarked at all. So with this information in hand, it may be necessary in the first instance for a doctor to go on board the ship to look at the crew member to assess his condition and decide what treatment can be given. If it's possible to treat him on board the ship, this may be necessary because there may be a reluctance, as Monica said, in the local ports to allow crew members to disembark just in case they are suffering from COVID, particularly because a crew member who is ill may have a temperature, which, as we all know, is one of the symptoms. So once the crew member is assessed, if the doctor decides that the crew member needs to come off the ship, then he may need to be hospitalised in a local hospital. That may be difficult as well in these times of restrictions because other countries also have very restricted hospital capacity and also restricted doctor and nurse capacity. And this is where, once again, the correspondent and the agent are vital in their assistance. So once the crew member has been treated, he may be fit enough to return back to the ship with the appropriate treatment and medication. However, he may not be fit to return back to the ship and he may have to remain in the country of treatment for a while longer. The ship may sail and then we have the difficulty of repatriating the crew member. But I'll deal with repatriation in the latest slide. Thank you. Next slide. So crew injury, you would imagine that a crew injury may be slightly easier in these pandemic times because a crew member who is injured may not be displaying some of the illness symptoms which can cause some concern ashore. However, the crew injury repatriations are also much more difficult than they were pre-COVID times. As with an illness, we will require the assistance of the local correspondent and agent to advise what the situation is ashore. Is it likely that the crew member can come ashore? If he can come ashore, then as with an illness case, he's very likely to have a COVID test before any treatment can be carried out. A doctor may have to come on board to assess, first of all, the injuries and decide whether or not it is necessary for disembarkation. We have had instances, even recently, where a crew member has suffered an injury, but he's been unable to disembark until much later in the evening, because whilst there's been a clinic available to treat him, there haven't been any medical staff because they have been very busy in the local hospitals dealing with COVID patients. That can be quite distressing for a crew member who suffered an injury, or indeed who's feeling very unwell because of an illness, having to wait on board the ship for a doctor to come on board to assess him, and then to have to wait even longer to possibly be hospitalised. So with a crew injury, if a crew member is hospitalised, as I said, he will have to have a COVID test. He will have to wait for the results of those tests, so there'll be a period of isolation, and then he'll undergo treatment and medication. As with a crew illness, the doctors will then decide, is the crew member fit to return to the ship, or will he have to remain in the country for further treatment, or will he have to be repatriated? If the crew member can return to the ship, then he may have to return with some medication, with some treatment, and with follow-up advice. Next slide, please. So dealing then with repatriation. As you will all have experienced, repatriation is more difficult than it was pre-COVID times. As Monica has already said, there's difficulties in different countries with restrictions, and it's been very difficult for crew members to repatriate even if they're not ill or injured. So some of the difficulties are restricted flights, there may be some curfews, there may be last-minute cancellations, which can be very frustrating for a crew member who thought he was just about to go home. If the borders are closed, then early on in the pandemic, it was very difficult to know when the borders may open and whether any flights would be available and when. There just wasn't any news to give to the crew member to give him any hope. This may result then, and has resulted in our experience, in long stays in the country of treatment. And this once again is where our correspondents have been invaluable in providing much needed assistance to that crew member to make sure that they have all they need to keep their spirits up, to make sure that they can communicate with their families at home, let them know that they're safe, and also to keep updated in relation to any borders opening, any flights, keeping everybody updated. If with an illness or an injury, the crew member has been able to go back on board the ship, either because they're fit enough to travel and they will be fit to work after a few days rest, or indeed because it's better for them to go back on board the ship because there's just no hope of any repatriation from that country, then there's probably going to be the need for follow-up appointments and also the need to repatriate from another country. So again, correspondents from the next country where the ship intends to go will be able to provide updated advice about whether or not flights will be available to repatriate that crew member, and make arrangement for any follow-up treatments which will be needed to make sure that that crew member has all the medical treatment and updates that he needs. Once again though, if the crew member has to disembark for any follow-up treatment or for any flights, then there will be further quarantine restrictions, further COVID testing. By now the crew member could have been tested 3 or 4 times. Next slide, please. So post-repatriation, you would imagine that the crew member would breathe a big sigh of relief and think, oh, I'm home. Unfortunately, as we know, all the countries in the world are suffering from some kind of restriction at the moment in view of COVID. And we did think that we would be much further on by now, but unfortunately there are still restrictions. And so the crew member returning home after a number of months will likely be tested again when he lands in his home country. He will likely have to isolate again until that test result is available. We will have to assess which treatment centres are available to treat him depending on the nature of the treatment needed and the length of that treatment. We've also experienced, and you may also have experienced, that there's been difficulty also in returning luggage to a crew member, and that can take quite some time, which can also be very distressing if the crew member has a number of his valued possessions in his luggage. During the recovery period, because the home country of the crew member may have continuing restrictions, the treatment may be limited. The treatment may not be available in his local town or his local area, and so he may have to seek treatment from a bigger town in a bigger area. This may mean that he can't then return home to his family at all, even though he's been home for a number of weeks. He may have to have treatment in a larger city. He may have to stay there until his treatment's over, because he won't be able to travel backwards and forwards to his home in view of COVID restrictions. All of this is likely to lead to an extended period of treatment and possibly an extended period of recovery also, which can be another very distressing matter for a crew member who, as we've discussed over the past few slides, has already been through quite a bit. Next slide, please. Finally, I just wanted to draw your attention to a series of posters presented by our loss prevention department. This is one of the posters in the React series, which relates to COVID-19. You can find this poster on the club's website. You can print it off and it can be displayed around members' vessels. Thank you very much. That's the end of my presentation. I'd like to pass you on now to Nigel Griffiths, who provides medical assistance and advice for the West. His talk is going to relate to mental health in the COVID-19 era. Thank you, Nigel.
Thank you for the introduction, Helen, and a pleasure to be here speaking this evening or this morning, wherever you are. I'm here to speak on the mental health issues that we'll see related to COVID. Next. Troubled times, troubled minds. We've always had mental illness at sea. It's nothing new. But there are additional challenges and trigger factors that we see in the COVID era. Next. So mental health pre-COVID, what has been said about it? In 2019, research was carried out by Yale alongside the ITF Seafarers Trust, showed that 17% of seafarers had anxiety and 20% had suicidal intentions. The study also highlighted that, compared to other groups, seafarers, especially young ones, were more likely to develop mental health problems. It concluded that improving seafarers' mental health should not just be a moral obligation. It makes good business sense, explains the report, and happy seafarers are more motivated and productive, and the investment is well worth the support. Next. There's a lack of good research, and I think I would agree with this. The human element is increasingly acknowledged as an important factor contributing to accidents at sea. What is infrequently considered, however, Helen Sampson tells us, is the extent to which social isolation and its effect on seafarers contributes to both marine incidents and to the problem of seafarers' retention experience for the industry as a whole. Next. There is research carried out by various organizations. They have looked at the concept of happiness. Are seafarers happy? Frankly, it's not the duty of the ship owner to ensure that the seafarer is happy. The seafarer goes to work, earn money for his family, etc. And happiness, if he can be happy in doing the job, is a good thing. But I don't think there's an obligation. I think that studies that have been carried out maybe have been flawed by looking at the concept of happiness and its social standing. Next. So what are the dilemmas one sees? Both Helen and Monica touched on them. Difficulty changing crew resulting in extended contracts. Local lockdown has been put in place so crew cannot be processed to join ships. Public health imposes restrictions enforced in conjunction with immigration on crew changes. A significant drop in the number of commercial flights after lockdown lifting, resulting in crew being unable to join ships. There's been no shore leave, operational dilemmas if safe manning levels are breached because of incidents of COVID aboard ship. Lastly is the revocation of visas which have previously been issued. Next. So Let's look at these one by one. The difficulties changing crew. Seafarers go to sea with an end date in sight. That end date now is a very, very loose concept, and there is no actual date as to when they can get off the ship or get back to their home country. This leads to uncertainty. What then results may be depression, anxiety, and aggression are all symptoms that one sees of the underlying frustration. Next. In respect for the various countries and their sovereignty, there is no universal public health policy set by the World Health Organization. Each country is at liberty to set what it thinks it requires for the security and for the well-being within its own borders. Sometimes it's realistic, sometimes perhaps not realistic. Public health imposes restrictions enforced in conjunction with immigration on crew changes. Next. The number of flights, well, there's certainly less flights about than there were, and that in turn gives us a decrease in possibility for repatriation or for the homeward journey of crew members following their contract from regular disembarkation. In addition to that, of course, there is social distancing employed by the airlines, which also gives us some problems in that there's a decrease in the number of seats available on commercial flights. Next. Validity of visas. Japan, for example, issued a notice saying it revoked the visas it had issued because they wanted to remove the pre-border clearance that the visa implies. Many countries have changed their entry requirements in relation to COVID. Next. On the 24th of September this year, the Secretary General of the UN pleaded with member states to get seafarers designated as key workers, which would expedite the process of seafarers joining vessels, which in turn would allow the crew to be disembarked from vessels. Next. So a little stress is good for everyone, keeps them on the edge of their chair, but stress is a difficult commodity. It derives from difficulties mentioned and causes difficulties both on the crew member and on his family. And stress leads to altered behavior, especially on board vessels where we see aggression and violence occasionally. Next. Employment uncertainty is sure a factor. It's very evident, for example, in cruise ships, in particular, where the cruise ship industry is certainly under scrutiny. Its future is under question, despite the fact that there are many people who want to go back to sea, and also those holiday makers that want to go back to sea aboard cruise ships. So there's a willing market there, but there are a lot of restrictions that have to be overcome first. And employment uncertainties, and I've heard from the Philippines that crew are not convinced that they're going to get their jobs back anytime soon. Next. So all crew, of course, are governed by contract. But in the 21st century, it would be very difficult to separate the concept of contract and moral obligation. There must be a moral obligation associated with the employment of seafarers, and that encompasses what we owe to each other. Next. The theory of well-being defined as what makes someone's life go better. The considerations and constructs of that must be realistic, rational, and they must exhibit prudence. There's no single notion of well-being. What appeals to one person may not appeal to another. But any action must be addressed from a utilitarian perspective, that is, that it's for the good of everybody or for the majority. In short, the focus must be on the majority of the crew benefiting from the well-being. And this freedom to achieve well-being is to be understood in terms of people's capabilities and the real opportunities and values. Next. Okay, according to the John Rawls, who's a political philosopher, or was a political philosopher in the United States, he speaks of primary goods, and those are what individuals prefer to have more of rather than less of. Going back to our previous slide, I mentioned everything has to be rational. For example, the AB would like to be paid the same as a master, but that does not keep with rationality, and as such is impractical. But it does. Rights, liberties, opportunities, income, and wealth are the facts that Rawls focuses on. And in a just world, we should look at what the primary goods that we want to bring about as part of the seafarer's life to benefit the crew on board. Next. Seafarers need to be alert. Precision is very important. One can think over the last 100+ years, from the Titanic to the Ramona to the Costa Concordia. I was addressing a meeting conference, the Asian conference of the Nautical Institute last year, and especially to the cadets. I was saying, when you are on the bridge or in the engine room, you have to be alert. There has to be concentration, and there has to be attention to fine detail. If there's any doubt about that, then refer to the Danish Maritime Authorities marine accident report on the Ramona, a vessel which collided with a railway bridge. And we can see how very, very careful and very, very specific one needs to be in respect of concentration and attention to detail. Next. Depression, the blue plague, of course, if you're kept on board a ship for far too long, depression is inevitable. Next. Self-harm, we do see that on board ships. Unfortunately, we saw that before COVID, and we may well see it during the COVID as a stress-related problem, especially with extended contracts for long periods. Next. One must always be mindful of the potential of suicide. It's important whenever you're doing a psychological assessment on a patient to rule out, or as certain as you can be, that the patient is not suicidal. It's very, very tragic when this happens, the circumstances in which it happens, for which it happens, and the effect on, of course, the crew member's family. It's all a very tragic thing, and we need to be supportive of those who have suicidal thoughts. Moving on, next. This is an actual slide of a girl lamenting over the coffin of her father. He died in Saudi Arabia. It took, I believe, 56 days to get the body back to the Philippines. And it wasn't from suicide, but I'm talking about now the effect on the family when suicide does occur, and the devastation that that causes. So in Munu's day, into God's hands, we would prefer to avoid that. Next. Concluding, never close the door on those that exhibit mental health symptoms. It's very important that we listen to them. It's very important that we accommodate them. And it's very important that we do something about the seafarer when we become aware of it. Next, I believe that's all from me. Thank you very much for listening. And I hope that was informative. Thank you.
Thank you very much, Nigel, for your very interesting and relevant presentation. Thank you. And now I'd like to pass you on to Steve Knaggs, who will talk to you about claims handling, a changing role.
Thank you very much, and good morning, good afternoon, and good evening, wherever you are in the world. I have regularly been asked over the last few months what the effect of the pandemic has had on claims. So when developing this webinar, I thought it would be interesting to see whether there had been an effect on the club's claim statistics and the type of claims that are being handled. So next slide, please. So we're going to look at some stats, and then we will address the claims handler's role and how it may have changed during the pandemic. And then I'm going to pass you over to Dughall Aitken for his thoughts from the perspective of a correspondent. So next slide, please. The purpose of this graph was to compare incidents recorded by the club during the 2020 policy year with that of previous years. At the bottom, you'll see various incident types, and we've selected a number of crew-related claim types, as well as traditional P&I, and also on the right there, our FD&D claims incidents. Now, the dark blue column reflects a 3-year average of incident files opened between 2017 and 2019. And the light blue green, that represents the incident files opened this year. And I'll break these down further in a minute, but what most of you will probably be drawn to is the middle column and the quite dramatic decline in cargo-related incidents. Normally, we would expect well over 1,000 recorded cargo incidents in the first 3 quarters of a policy year. But this year, however, we have seen a 30% decline. And why is this? Well, it's not entirely clear. However, cargo availability issues, increase in vessel layups, less port interference, such as surveyors attending, people complicating matters perhaps, or just people needing the cargo. I mean, these are all possible factors, and it'll be interesting to see whether we return to pre-COVID levels once we are back to normal, whatever that may be. Now, the figures in relation to collision and FFO and FD&D defence all look very similar and in line with previous years. But the people risks is quite interesting. I personally was expecting a huge spike in injury and illness claims because as we've heard, leaving COVID aside, we are all aware of the difficult position crew have been in this year. And I would have assumed that those conditions would have led to an increase in illness and injuries recorded. There has been a small 15% increase in illness claims over the first 3 quarters of this year, but I would have expected more. And interestingly, 15% of the illness claims recorded this year are COVID related, which means the figures for non-COVID related illnesses are on a par with previous years. But injuries are well down, 25% reduction so far this year. One possible reason for this is because of the passenger ship layups. And we would normally expect about 15% of injury claims recorded in a policy year to be passenger related. But where have the other 10% gone? And that goes against the theory that when crew fatigue sets in, injuries increase. Next slide, please. Now, these 3 charts break the stats down into each quarter of the policy year. And generally, these follow the annual trend. However, there are a few interesting takeaway points. First is the crew illness stats. These seem roughly in line with previous years in the first quarter, but then increase in the second and third. The same can be said for FFO and collision. Now, hopefully we will be able to analyse these further once the policy year has been closed. But one suggested reason is actually due to crew fatigue that these have increased in the second and third quarters. Now, the other interesting column is the one on the right, the FD&D defence column. You will recall that this was on a very similar trend to previous years. However, in this breakdown, you will note that there was a 22% increase in FD&D recorded incidents in the first quarter of the policy year. And this followed a trend which began at the beginning of the calendar year, as owners became concerned about calling at certain ports and were beginning to explore their legal options. But what I found most fascinating when reviewing these statistics was a very basic one. And that was that claims in total under these headings which we've reviewed are down by over 10%. So if claims are down, is it not just business as usual for the club? Are we not just putting our feet up as claims handlers and watching TV as we're sitting at home? Next slide, please. Well, sadly not, far from it. I think everyone in P&I will agree that professionally this has been one of the most challenging years in recent memory. And why is that? Well, the claims handling role has become more complex. It's more challenging, more difficult. The industry has adapted incredibly well to remote working, but handling claims from our kitchens has been a challenge. Things such as unreliable internet, children running between your legs, or neighbours arguing do not make for a good working environment. And further, just not having access to your office resources, being able to turn round to run something by a colleague, are just some things that we have missed from office life. And although people are only a phone call away, that phone call is nonetheless a new barrier that wasn't there before. We've already heard about travel restrictions, and we as an industry have relied upon sending people around the globe to investigate incidents. And suddenly we can't do that anymore. And we are more reliant on local assistance and desktop assessments. For example, in September this year, the club was involved in a casualty incident off Sri Lanka. There were no commercial flights in and out of Sri Lanka at that time, and we needed to get naval architects. Salvor's representatives needed to get over there, as well as ITOV. And the only way to get these people mobilized into Sri Lanka was to hire a private jet. Very nice for them to travel in that way, but obviously it came at some cost. But it does mean that it is possible to travel, but you really have to consider whether it is absolutely necessary. Another example, we're involved in an FFO claim in Panama in June this year, and we still haven't managed to get a surveyor, a technical surveyor, to look at that, at the damaged infrastructure. What we have been able to do is ask the local surveyors and correspondents to take videos, take photos of the structure, and that has been analysed and put into computer models here in London to create, so that the experts are able to view that remotely. And this is a good example of how the industry has adapted using technology. But one of the most commonly asked questions by a claims handler to a correspondent is, well, can you just send someone down to the port to have a look at what's going on? And suddenly it's not that simple, because ports and terminals have restricted access in an effort to control the spread of the virus. We've also had to deal with evolving laws and evolving regulations relating to things such as quarantine and testing requirements. These are ever changing, and every nation has its own regime, and even within nations, certain areas have different regulations in place. The amount of information that has had to be collated and reviewed and distributed has been quite incredible, particularly in the first quarter of this year. And as things change quickly, the club has often become an extension of members' operations. So as well as handling claims incidents, we have found ourselves assisting members in what were previously routine operational issues. Crew changes is a fantastic example of that, as is providing guidance on general vessel itineraries. And an extension of this is what I've called problem solving. But it's more the question, what happens next? What if? For example, what happens if we called at a Chinese port for discharge in Korea, but someone gets ill on board? Or maybe 3 crew members get ill? Well, we have no crystal ball, and we don't know how the authorities will react to a specific incident. But we are continually trying to gather information to give a degree of certainty to members to make their operations run smoothly. And the result of this, in my view, it has increased the role of the claims handler on loss prevention and problem solving, as opposed to simply handling claims. Now, that's my take on it all, but we thought it would be interesting to get the view of one of our trusted correspondents to see how COVID has affected their role and their day-to-day operations. So I'm going to pass you over now to Dughall Aitken of SPICA Services.
Thank you, Steve, and good day, everybody from Singapore. Slide, please. I sit here in Singapore, which is the headquarters of SPICA Services, who are the club's correspondents in a number of countries in Southeast Asia. And I have an active claims role in 7 countries. And whilst the trade that we see and the nature of the claims that we see from those 7 countries is different from the container trade and the petrochemical trades, which dominate Singapore and Malaysia, to the dry bulk exports from Indonesia, dry bulk edibles from Thailand, Vietnam, and Myanmar, there are similarities in the nature of the claims that we've been facing specifically in the last 9 months. And we'll talk a little bit about how the claims experience has changed in the last 9 months, what the trends are, and also then finally we'll talk about the problems that we face and the solutions that we've had to come up with to enable us to continue to assist the club and its members. Slide, please. Working through the region. Indonesia, I wasn't at all surprised to see Steve's reference to the fact that cargo claims have dropped. Indonesia, as everybody will know, is a very disparate country. It takes a long time for us to get surveyors from one place to another. The reality is almost all claims handling, solution providing, and survey experience is based in Jakarta. And so you just have to parachute that expertise in wherever it is required. And that simply has not been possible for large periods of the last 9 months. There have been rolling restrictions of travel, which have meant in many circumstances that it just simply has not been possible to get surveyors to travel within Indonesia. People claims, you'll see if you scroll down the list, is a common refrain. And those who spoke before me have clarified the nature of the problems that we are all seeing. In some countries, Indonesia, for example, actually we saw many more sort of visa and immigration issues, and unfortunately often immigration problems such as those in some countries are seen as opportunities. But at the same time, the flexibility that exists in countries like Indonesia has meant that it has been possible for us to deal with some hospitalization and repatriation issues that theoretically weren't initially going to be possible under law. In Malaysia, we've seen a huge increase in the number of container claims, and that goes for Singapore too. And also uncollected cargo claims have increased as well. Dry bulk cargo has reduced for exactly the same reason, indeed, as it has in Indonesia. For example, the eastern states of Sabah and Sarawak on Borneo, it has simply not been possible to get surveyors from one port to another. So if a ship is loading in a remote port, it's simply, and if there's not survey expertise in that port, it is simply not possible to get somebody to attend on board. And from our perspective, we have seen dry bulk in some of the countries that we represent the club drop from over 85% of the work that we do to closer to 30. So dramatic drops there. With regards to people claims in Malaysia, there has been rule, there has been regulation, there has been law as to what is possible in Malaysia. But unfortunately, individual harbour masters, individual port health have often just resulted in a it's too difficult. So it's just refusal to land, even in situations where immediate emergency, life-threatening medical care is required in life-threatening situations. There's just been a refusal to land. It has been possible to get round these with for want of argument, essentially, and also for a ship that's prepared to or is able to stay in the port while a solution is sought. It has been possible, but it has been very difficult at the same time. In Myanmar, dry bulk has halted, much like Indonesia and Malaysia, but for a different reason. The vast majority of the dry bulk exports from Myanmar were edibles, is rice primarily. And because of the national contingency plan, which essentially said, look, we don't know what's going to happen going forward, and therefore we're not going to export rice in case we need it ourselves, essentially just put a lid on that particular trade. And so that stopped almost completely. People claims, I said people claims increased dramatically. They have increased by about 20 or 30%, which is a bit counterintuitive on the basis there's been no flights into and out of Myanmar. You know, there has been situations where flights have had to be arranged to get crews back wholesale from certain countries. But it's, you know, flights have been arranged, and when people have come back to Myanmar, the additional problem is that there are no doctors available to see them because Myanmar has a very, very strict, and Yangon particularly has a very strict lockdown. And that means unless an injury is immediately life-threatening, doctors are not allowed to see patients. So that means with Myanmar, perhaps more accurately said again, that the people claims the complexity of solving the problems has increased dramatically. Same with Singapore. Singapore has a very robust rule of law. And as a result of that, had a very detailed and very strict implementation of regulations in respect of taking any crew off the vessels. Crew change, illness, injury. They were very clear as to what was required, and it was onerous for ship owners in an effort to try and do this, but it was possible. There was a very clear procedure laid out by the Port Authority in Singapore as to what would be required in each of these situations. The problem that gave us was the fact that with many of the countries in the region, Malaysia we've mentioned earlier, Thailand and Vietnam we're about to mention, essentially just adopting a refusal to land because it was easier to do that than it was to try and address the issue. What that meant was people were forum shopping and coming to Singapore. They were bypassing Malaysia and Thailand, you know, on their way into Singapore, and then attempting to get crew off the ship in Singapore. The Port Authority in Singapore got a little bit concerned about that, as I say, about forum shopping, as you might imagine, and so that led to some difficulties as well, and again an increase in complexity. Thailand and Vietnam, just as I've said, realistically there was rules that stated you could bring people ashore, but Thailand and Vietnam were very insular, shall we say, in their approach to COVID, and were very aggressive in terms of not allowing people in, foreigners particularly. And as a result of that, in many places, it was just, as I say, a simple refusal to land, which made life very complicated. It was possible in many cases, but that really depended on the severity of the illness or the injury, and the ship having the capability to wait whilst these processes were concluded. Slide, please. So what does that look like in terms of trends? Well, bulk cargo has reduced substantially, as we said, because of primarily the cargoes are still being lifted, but restriction in travel has meant it's simply not possible. The vast majority in Indonesia, Malaysia, and Myanmar of the dry bulk cargo issues that we handle on behalf of the members of the club are pre-shipment or shipment of nature, and those have just stopped almost completely. Containers and uncollected cargo claims. The unconnected cargo claims really is a trend that I think many people have been seeing globally over the last sort of year, shall we say. But I think currently there's an element of people having a wee bit more time on their hands. And so there's been a definite uplift in that, particularly for us in Malaysia and Vietnam. The container increase, I mean, you will all have seen just in this week alone, it was announced that Shanghai was the first ever port in the world to go through 4 million TEU in 1 month. There's been studies out of Denmark again, I think this week, saying that the container trade as a whole is probably going to have a better year than it has in the last 10 years. Combination of all of that, the lack of air freight has obviously played a role in that. So there simply is more cargo traveling by sea, and just for want of speed in a replacement for air freight, much of that is taking place in containers. As far as the people claims are concerned, be it immigration related, be it crew change, be it illness or injury, be it COVID testing, as the speakers before me have all said, complexity has just gone through the roof. And so as a result of that, it's taking longer and longer for us to try and solve problems. Slide, please. So what does this look like for us in terms of the issues that we have been facing? I was struck that when I looked at Steve's presentation before me from the club's perspective, how many similarities there were to the nature of the problems that we face, which is perhaps unsurprising. But being based in country, closer to the pointy end of the spear, some of the issues were kind of much more relevant for us and really required some work to get around. Remote working, the principal difficulty from a correspondence perspective with the remote working is the fact that our skill, our value is in the intellectual capital that we build up over many years of representing the club and its owners. And as Stephen mentioned again, just having to make a phone call or going on a Zoom call with somebody represents a barrier that otherwise wouldn't exist. We have somewhere in the region of 40 claims handlers in SPICA in Southeast Asia. And when you're sitting in an office, there's a great deal of experience and expertise held in that office. But if you're not able to look across the hallway and say to somebody, what would we do in this situation? That makes life a little bit more difficult. Just that lack of osmosis in terms of information. Connectivity. Some countries, some cities, some districts where we operate simply have no robust internet connection. And so that has meant when we sent people home to work from home, and some of us have been working at home for the best part of 9 months now, those that had poor internet connectivity, it's been a struggle. But not just for SPICA's claims handlers. Many of the authorities that we deal with have no internet. They have no PCs. And so what that means is realistically, you have to, every time you try to solve a problem in Indonesia or some other countries, you physically have to go to the port authority, sit down with them, have a conversation with them, and explain what needs to happen. And obviously that simply has not been possible. And so it has restricted our ability to negotiate solutions for ship owners who find themselves in difficult situations. The restricted access, the travel restrictions essentially is the same argument. It's meant that even within a city, we have not been able to leave our office and go and visit the port authority, explain the nature of the problem, and negotiate a solution with them. And obviously that's making life much more complicated for us. The regulatory environment, everybody has mentioned it who's spoken before me. We are just, it's constantly changing. As authorities, as port authorities, as health authorities, as immigration authorities tweak the regulations as they learn as we go through this process. And so the continual change just makes it much more complicated. And when that's combined with some countries, it's just easier to say no. For an authority, rather than helping to try and solve a problem, it's easier to say no in the hope, as I mentioned earlier, that the ship will go somewhere else with the problem. As a correspondent, it's fine, we can argue that position, but again, it depends on the ship and the ship owner having the will, having the ability to stay in a port whilst the negotiation is sought. Expectation, the last two, the expectation and the cost, are really correspondent specific. We've talked throughout the last 45 minutes about increasing complexity, but expectation doesn't change. Ship owners and operators still expect a solution to their problems, and that's fine. We just have to work a little bit harder to try and find them. But it is increasingly difficult, and with that continued level of expectation and the evident complexity that exists. It takes more time, it takes more effort, and therefore, unfortunately, cost. to try and solve these problems. Which again leads to another issue, that being, but I only paid $100 for that same service last year. That is unfortunately the way of the world. And I wonder, thinking back to Steve's slides, whether or not, when we're looking at those changing levels of, for example, crew illness, for example, whether or not actually there would be an increase in cost, even though there is a slight reduction in the number of claims. Slide. There we are. Thank you very much.
Thank you very much, Dughall. I thought that was very, very interesting. And I think sometimes as a club, we take our correspondence for granted, but this year in particular has shown how much we depend on that network and the local knowledge. And just picking up on that last point, I certainly think that although the claims trend on my research suggests that claims are generally down in numbers, I certainly think that the costs incurred by the club will have gone up. Well, that will be seen later on. So I'll pass over now to Enam to round up.
Thank you very much, Steve. Which leaves me to really thank all the speakers. And really, I think we can all agree that there is no doubt that the COVID-19 pandemic is one of the biggest challenges the global shipping industry has ever faced. And it has so far adapted and responded accordingly to deal with some aspects of the industry. But however, I did want to conclude the webinar by taking the focus back onto seafarers. Whilst it's fully appreciated the governments and the port authorities have many pressing issues to contend with, however, the plight of seafarers should still be high on everyone's agenda. To the extent that the issues are not resolved, seafarers' lives and the lives of their families will continue to be adversely impacted. The West shares the concerns of the IMO and the ILO for the long-term well-being of seafarers. As we've heard in the talk, many of them who have been home for over a year, and they still face considerable uncertainty as to when they may do so. As Nigel's flagged up, such long tours of duty are mentally and physically draining. They can affect their ability to perform duties on board in a safe manner. The West, together with the international group, continues to work with a number of industry organisations to find a way forward, with International Chamber of Shipping leading on the issue of from Shipowners' side. The industry has sought to provide workable solutions to governments to help effect these crew changes safely and efficiently. Most recently, there's an update, which Monica touched upon, on the protocols for ensuring safe ship crew changes and travel during the COVID-19 period. And this has been submitted to the IMO by the ICS for endorsement. As we've seen, a number of governments have already engaged constructively with this process. However, it is hoped that more and more governments will recognise seafarers as key workers and enable crew changes to take place in accordance with these protocols. So thank you all very much.